Hi, Sam here from Study in Australia TV. Today we're going to talk about study discipline information, professional bodies, and career options across health science programs. We'll give you an overview of programs in these areas, what professional associations are relevant to those programs, and what career pathways and job options are available in Australia if you stay on after your studies and access the post-study work visa. The program information we'll cover is general in nature, so it can vary slightly between universities. But it'll give you a good overview of the areas you can study in Australia and what career or job it may lead to in the healthcare sector. In this field, studies will provide students with a thorough knowledge of human health and the Australian healthcare system. In fact, 5 Australian universities are ranked in the world's top 50 medical schools for medicine, which indicates the quality of the medical schools in Australia. Also, it's important to know that healthcare is one of Australia's largest and fastest growing industries. Plus, nursing is one of Australia's top employing occupations for health professionals. Students in these disciplines will learn how to problem solve, communicate, and adapt to working in a variety of dynamic health and medical environments, restoring the physical and mental well-being of people. The medicine, nursing, and allied health fields teach students the theory and practice related to industries such as biotechnology, dentistry, exercise physiology, laboratory medicine, nursing, nutrition and dietetics, occupational therapy, medical radiation, pharmaceutical science, pharmacy, physiotherapy, speech pathology, and sports science. So let's start with medicine. The Bachelor of Medicine provides an in-depth and inspiring pathway into the world of medicine. Medical practitioners look after the well-being of individuals and the causes of illnesses and ill health, working as professionals to protect the health of people in our communities. Medical practitioners in Australia work in public hospitals, private practice, public health units, and clinical research, or they go on to specialise in a specific area of medicine. Graduates could be a specialist paediatrician, for example, and work with children and families, or go into orthopaedics and focus on injuries and patients' musculoskeletal system, or ophthalmology and work on the diagnosis and treatment of eye disorders. Or become a general practitioner and work in a private GP clinic, providing vital services for a local community. After 6 years of undergraduate study, to qualify for registration with the Medical Board of Australia, students will need to complete a year as a hospital intern. Medical practitioners in Australia are in demand and there are many varied opportunities after studying medicine. It is, however, a more difficult degree to enter, and many Australian universities now offer medicine as a postgraduate program so that students are older and have more life experience. In this case, students are required to study an undergraduate program with a health science focus to qualify. The professional body responsible for overseeing medicine in Australia is the Australian Medical Association, or AMA. The AMA is the peak professional body for doctors in Australia and promotes and protects the professional interests of doctors and the healthcare needs of patients and communities. Representing doctors, the AMA works with the government to develop and influence health policy to provide the best outcomes for doctors, their patients, and the community. The AMA represents and supports all Australian doctors and medical students and is a member-run and led body, fighting for fairness and equality, lobbying and campaigning on the issues affecting the medical profession. They provide the tools, information, and resources to assist GPs in their professional and business lives. GPs have a say in the work of the AMA through the AMA Council of General Practice, also known as AMA-CGP. The AMA believes that private practices are an essential component of a sustainable Australian healthcare system. Private specialists have a say in the work of the AMA through the Council of Private Specialist Practice, or CPSP. The AMA also lobbies for the rights and the concerns of public hospital doctors in Australia. Public hospital doctors have a say in the work of the AMA through the AMA Council of Public Hospital Doctors, or CPHD. Given Australia's geographical breadth, it's important to champion medical care for rural and remote communities. The AMA is committed to addressing the shortage of medical practitioners in rural and remote Australia by removing access barriers to improve the health and well-being of rural communities. GPs have a say in the work of the AMA through the AMA Council of Rural Doctors, or CRD. CRD develops new and revises existing policy on issues that relate to the delivery of health services and remote medical and workforce issues in regional, rural, and remote areas of Australia. The Australian Medical Students Association, or AMSA, is the peak representative body for Australian medical students. AMSA is a vibrant student-run organisation that represents, informs, and connects all of Australia's medical students. Hundreds of medical student volunteers work together to run professional standard events, advocacy campaigns, special interest groups, community and wellbeing initiatives, projects, and publications. To become a member of the AMA, please visit the AMA website at ama.com.au and complete the online member registration form. Job opportunities in Australia in the medical profession are broad. There are currently over 2,500 jobs for doctors advertised on Seek, Australia's top online job and career website, with a job growth expectation of 15% over the next 5 years. Most common salary for a doctor is over $200,000. Now let's look at dentistry. Dentistry, also referred to as dental medicine or oral medicine, is a branch of medicine that focuses on the study of oral health and teeth. Students can study a full range of dental therapies, from complex restorative to preventative-based treatments. Students will typically practice using equipment in simulation clinics, be exposed to real-life case scenarios, and undertake practical placements in real-life dental clinics. Upon graduation, and after gaining registration with the Dental Board of Australia, students can either work in a private dental clinic or in the public sector in a government, community, or school-based dental clinic. The Australian Dental Association, or ADA, is a not-for-profit professional membership organisation. Its members include the great majority of practicing dentists, nearly all students of dentistry, and a committed cohort of retired dentists. The ADA is the peak national body for dentists, a voluntary member organisation with branches in every Australian state and territory. It has 3 main objectives: to support members by enhancing their ability to provide safe, high-quality professional oral health care, to encourage the improvement of the oral and general health of the public, and promotion of the ethics, art and science of dentistry. ADA branches provide education and face-to-face assistance to members, delivering public oral health advisory services, and advocating on issues impacting key stakeholders in a particular state or territory. The ADA is committed to having the best dentists in the world, in a nation with the best oral health care. As a not-for-profit organisation led by dentists for dentists, the ADA remit is to deliver value to members. Though it's a requirement, CPD is also an opportunity to get ahead with the most valued skills and capabilities. Unbox your career with the most comprehensive and respected CPD resources for dentists in Australia, including hundreds of live events annually and members-only online learning and CPD log. As a member, you have access to free HR, IR, and pharma advice lines, as well as a peer advisory service. The ADA represents dentists in the 3 critical areas of workforce supply: preserving the child dental benefit schedule and scrutiny of private health funds. No matter where you are in your career, the ADA provides access to both face-to-face and online events, forums and programs designed to specifically connect members. By offering a mix of social events, lifestyle inspiration, and benefits for members. To become a member of the ADA, please visit the ADA website at ada.org.au and complete the online member registration form. Job opportunities in Australia as a dentist are mostly in private practice. There are currently over 2,000 jobs advertised on Seek, with a job growth expectation of 16% over the next 5 years. Most common salary for a dentist is over $200,000. Let's move on to nursing. Nursing in Australia is a highly respected profession, and qualified nurses are in demand. Students will learn how to treat patients in a range of healthcare settings and benefit from clinical simulations and real-life practical experience to learn how to detect, diagnose, and manage chronic and acute illnesses. Students will graduate with a professional qualification, ready to work in general hospital wards, operating theatres, emergency wards, and a range of healthcare environments. There is 2 professional bodies that oversee nursing: Australian Nursing and Midwifery Federation, or ANMF, and Australian College of Nursing, or ACN. ANMF is Australia's largest national union and professional nursing and midwifery organisation. In collaboration with the ANMF's 8 state and territory branches, ANMF represents the professional, industrial and political interests of over 300,000 nurses, midwives and carers across Australia. ANMF members work in the public and private health, aged care and disability sectors across a wide variety of urban, rural and remote locations. ANMF works with them to improve their ability to deliver safe and best practice care in each and every one of these settings, fulfill professional goals and achieve a healthy work-life balance. ANMF's strong and growing membership and integrated role as both a trade union and professional organisation provide complete understanding of all aspects of the nursing and midwifery professions and is uniquely placed to defend and advance the profession. Through members, ANMF aims to strengthen the contribution of nursing and midwifery to improving Australia's health and aged care systems and the health of our national and global communities. To become a member of the ANMF, please visit the website at anmf.org.au and complete the online member registration form. The Australian College of Nursing, or ACN, supports members to be the best they can be by keeping them informed, connected and inspired. ACN is committed to shaping health and advancing nursing to enhance healthcare and strongly believes that all nurses, regardless of their job title or level of seniority, can be leaders. By bringing together thousands of extraordinary nurses from across the country, ACN builds a strong collective voice for nursing and commands the respect and recognition the profession deserves by advocating on behalf of the nursing profession, helping to shape healthcare and aged care policies, nurturing the nurse leaders of today and tomorrow. ACN is also an accredited institute of higher education for qualified nurses. As an educational organisation, ACN offers postgraduate, continuing professional development, or CPD, and training courses that are renowned for equipping nurses with further knowledge of their chosen speciality and extending their clinical skills. ACN specialises in nurse leadership education, courses and workshops, and also develops customised education courses to meet organisational training needs. To become a member of the ACN, please visit the website at acn.edu.au and complete the online member registration form. To become a registered nurse in Australia, you must complete a 3-year Bachelor of Nursing, then register with the Australian Health Practitioner Regulation Agency, or AHPRA. You'll need to renew this registration annually. To become an enrolled nurse, you must complete a Diploma of Nursing and then apply to the AHPRA to practice as an enrolled nurse. Your registration will need to be renewed annually. The first thing you'll want to consider is whether you want to become a registered nurse or an enrolled nurse. So, what is a registered nurse? Most nurses working in Australia are registered nurses, also known as RN. As a registered nurse, you'll assess and manage a patient's healthcare, administering medication, monitoring their health and caring for them. A registered nurse has a higher level of responsibility and accountability than an enrolled nurse and can manage a unit or a team. To become a registered nurse, you'll need a Bachelor of Nursing. So what is an enrolled nurse? Also known as an EN. Enrolled nurses play a crucial role in providing healthcare to patients working under the supervision of a registered nurse. As an enrolled nurse, you'll be able to work in most healthcare settings. You'll assess, plan and implement care for patients. APRA works with the 15 national boards to help protect the Australian public by regulating Australia's registered health practitioners. Their primary role is to protect the public and set standards and policies that all registered health practitioners must meet. Job opportunities in Australia as a nurse are mostly in public and private hospitals. There are currently over 11,000 jobs advertised on Seek, with a job growth expectation of 15% over the next 5 years. Most common salary for a nurse is over $100,000. There is also a range of allied health programs that students can study in Australia. The most popular allied health fields include physiotherapy, pharmacy, medical radiation, occupational therapy, nutrition, dietetics, pharmaceutical science, biotechnology, speech pathology, and sports science. Generally, health science programs with a clinical outcome include practical components where students treat patients under supervision so that they can learn through practical real-life examples. Examples of programs offering this real-life practice include medicine, dentistry, nursing, pharmacy, physiotherapy, medical radiation, occupational therapy, and podiatry. It's also important to note that the English language requirements for international students for health programs are usually higher than other programs because graduates are required to have a high level of language skill when communicating with patients. Let's look at what the requirements are to work as a physiotherapist in Australia. To work as a physiotherapist in Australia, You need to complete a tertiary qualification in physiotherapy, such as a Bachelor of Physiotherapy or a Bachelor of Applied Science Physiotherapy. Alternatively, for students with previous science-based tertiary qualifications, you can complete a 2-year Master of Physiotherapy program. Physiotherapists must be registered with the Physiotherapy Board of Australia via the Australian Health Practitioner Regulation Agency or AHPRA before they can practice. All physiotherapists registered in Australia must also complete 20 hours of continued professional development or CPD annually. CPD can include attending lectures or conferences, reviewing journals, or presenting educational sessions at work. To register with the Physiotherapy Board of Australia, please visit the website at physiotherapyboard.gov.au and complete the online member registration form. Job opportunities in Australia as a physiotherapist are mostly in private practice and public hospitals. There are currently over 4,000 jobs advertised on Seek, with a job growth expectation of 14% over the next 5 years. Most common salary for a physiotherapist is over $85,000. Moving on to pharmacy now. Pharmacists must be registered with the Pharmacy Board via the Australian Health Practitioner Regulation Agency, or AHPRA, and meet the board's registration standards in order to practice in Australia. Under the national law, pharmacists have obligations they must meet in order to be registered and to practice as a pharmacist. This includes completion of an approved program of study, internship, and examination. They must meet national registration standards, codes, and guidelines. They must renew registration every year and notify the Pharmacy Board of changes to principal place of practice, name, or address within 30 days. They must maintain recency of practice, carry out and record continuing professional development or CPD each year, make mandatory notifications about notifiable conduct, notify in writing within 7 days if charged with or convicted of an offence punishable by 12 months jail or more, and comply with orders to check renewal declarations. The reason for these strict registration rules is because pharmacists work mostly in chemists, where they dispense prescribed medication to patients and monitor their drug treatments. They also commonly work in hospitals, where they provide pharmacological information to other healthcare professionals. So it's a very responsible area. To become a pharmacist, you need to complete a qualification such as a Bachelor of Pharmacy. This is usually a full-time 4-year course. Students are required to complete supervised pre-registration training as part of their study before they can register to practice as a pharmacist. You'll also be required to meet mandatory health and legal checks before undertaking a clinical placement. Students then apply for provisional registration. This ensures that all recent graduates are registered with the Pharmacy Board of Australia, which is required for all those wishing to work as a pharmacist in Australia. Then, students obtain an internship under the guidance of a registered pharmacist. To register with the Pharmacy Board of Australia, please visit the website at pharmacyboard.gov.au and complete the online member registration form. Job opportunities in Australia as a pharmacist are mostly in pharmacies or chemists and public hospitals. There are currently over 1,800 jobs advertised on Seek, with a job growth expectation of 7% over the next 5 years. Most common salary for a pharmacist is over $80,000. What about medical radiation? As a radiographer, you will produce high-quality medical images, or radiographs, using advanced technical equipment. As a radiographer, you'll be trained to do many tests such as X-rays, which use radiation to look through the body, magnetic resonance imaging, MRI, which uses magnetic imagery to build a map of body tissues, and computed tomography, CT, which takes cross-section views of different areas of the body. Although radiographers can take images of a patient, they are not qualified to make a medical diagnosis. This is the responsibility of the radiologist. To become a radiographer, you'll need to complete a university bachelor degree in medical imaging, medical radiation science, or technology, such as a Bachelor of Applied Science, medical radiation. After graduation, you will then need to gain 1 year's clinical experience before you can become a fully qualified radiographer. Then register with the Medical Radiation Practice Board of Australia, or MRPBA. Obtain a radiation use licence in the Australian state or territory you wish to practice in. And to register with the Medical Radiation Practice Board of Australia, please visit the website at medicalradiationpracticeboard.gov.au and complete the online member registration form. Job opportunities in Australia as a radiographer are mostly in radiology departments and public hospitals. There are currently over 450 jobs advertised on Seek, with the most common salary for a radiographer over $100,000. Let's look at occupational therapy. As an occupational therapist, or OT, your primary goal is to help people carry out daily tasks independently. You may work in hospitals, workplaces, schools, nursing homes, private clinics, or private homes. OTs assess injured workers to determine the best way to help them get back to work, or visit workplaces to gain an understanding on what challenges an injured worker may face when trying to get back to work. They review high-risk manual tasks at workplaces to determine how they can be performed more safely, and they provide clinical opinions and justification through comprehensive report writing. To become an occupational therapist in Australia, there are two different pathways available. Complete an undergraduate degree in occupational therapy. Undergraduate occupational therapy courses in Australia generally take 4 years. Alternatively, after completing an undergraduate degree in any field, you may complete a master's degree in occupational therapy. This pathway will generally take 5 years. 3 years for the undergraduate degree and 2 years for the master's program. There may be prerequisite subjects that you must complete in your undergraduate course to be eligible to apply for a master's program to become an occupational therapist. Then you would gain work experience, generally working with people with disabilities or sports or work injuries. Then you need to register with the Occupational Therapy Board of Australia and meet the board's registration standards in order to practice in Australia. To register with the Occupational Therapy Board of Australia, please visit the website at occupationaltherapyboard.gov.au and complete the online member registration form. Job opportunities in Australia as an occupational therapist are mostly in public hospitals and some private practices. There are currently over 3,500 jobs advertised on Seek, with a job growth expectation of 17% over the next 5 years. Most common salary for an occupational therapist is over $85,000. So what about dietetics? What's it like to be a dietitian? Dietitians are qualified healthcare specialists who specialise in the field of human nutrition with a focus on the relationship between food and health. Dietitians undertake mandatory tertiary study and are experts in dietetics, using this knowledge to provide people of all ages with guidance on how to manage their diet, reduce risk of illness, and improve their health. Dietitians plan diets and menus and provide guidance on the functional requirements and importance of diet and on the planning and preparation of food, collect, organise, and assess relevant health and nutritional data. Plan and implement regular nutrition assessments and intervention programs. Monitor food intake and quality against a diet plan. Consult with other health professionals and related workers to manage the dietary and nutritional needs of patients. People often make the mistake of interchanging dietitians and nutritionists. However, while they work in the same sphere, their roles are quite different. Broadly, a career in nutrition can cover everything from how we grow food all the way up to what people eat. A nutritionist uses nutrition and food knowledge to promote healthy societies. The easiest way to understand the difference between dietitians and nutritionists is to think of dietetics as a specialisation on top of your nutritional studies. Dietitians can work in any of the areas a nutritionist can work and have the added qualifications to work one-on-one with clients to deliver tailored nutrition management or medical nutrition therapy. To become an accredited dietitian in Australia, you need to complete an accredited university degree in nutrition and dietetics. This often means an undergraduate degree in science, then a master's in dietetics. After completing your study, you need to gain accredited practicing dietitian or APD accreditation via a 1-year supervised provisional program accredited by the Dietitians Association of Australia or DAA, including mandatory continued professional development or CPD. Once ADP accreditation is achieved, you'll need to complete the minimum 30 hours CPD to renew your ADP accreditation each year. Job opportunities in Australia as a dietitian are mostly in public hospitals and some private practices. There are currently over 370 jobs advertised on Seek, with a job growth expectation of 10% over the next 5 years. The most common salary for a dietitian is over $80,000. Podiatry is another allied health science occupation. What's it like to be a podiatrist? A podiatrist is an allied health professional who specialises in the treatment of disorders of the foot, ankle, and lower leg extremity. Podiatrists diagnose diseases and deformities of the foot using medical histories, x-rays, laboratory tests, and physical examinations. Treat deformities, prescribe and make orthotic inserts for patients when they're required, and perform minor surgical procedures like ingrown toenail surgery or plantar warts using a local anaesthetic. To become a podiatrist, you need to complete a university degree such as a Bachelor of Podiatry. The coursework includes theoretical and practical lessons, as well as clinical experience. Alternatively, you may complete an approved undergraduate degree and a Master of Podiatry. Then register with the Podiatry Board of Australia at podiatryboard.gov.au. Many podiatrists choose to specialise based on their experience or interests. Common areas of specialisation include sports medicine, biomechanics, arthritis, and gerontology. Job opportunities in Australia as a podiatrist are mostly in private practices. There are currently over 460 jobs advertised on Seek, with a job growth expectation of 14% over the next 5 years. Most common salary for a podiatrist is over $85,000. What about speech pathology? What's it like to be a speech pathologist? Speech pathologists help people who have communication impairments, including speaking, listening, language comprehension, reading and writing, or speech impediments such as stutters. They work with people of all ages, often with children who are having problems developing speech. Speech pathologists work with children to alleviate communication impairments due to intellectual disability, developmental delays, physical disability, and/or learning difficulties. Treat adults whose language, speech, or voice has been affected by surgery, debilitating disease, or brain injury. Help patients to overcome stutters and other speech impediments, and also assess and treat patients who have difficulty chewing and/or swallowing. To work as a registered speech pathologist in Australia, you need to complete a degree in speech pathology at an accredited university. After completing your study, you need to register with the Speech Pathology Australia or SPA to become a Certified Practicing Speech Pathologist or CPSP. Register via speechpathologyaustralia.org.au. Once certified, enter into the SPA's Professional Self-Regulating or PSR program, demonstrating a mandatory amount of continuing professional development or CPD each year. Job opportunities in Australia as a speech pathologist are mostly in public hospitals and some private practices. There are currently over 1,200 jobs advertised on Seek, with a job growth expectation of 24% over the next 5 years. Most common salary for a speech pathologist is over $85,000. There are more allied health science programs in sports science, pharmaceutical science, biotechnology, laboratory medicine, and the alternative natural therapies like herbal medicine, shiatsu, remedial medicine, chiropractic, naturopathy, and massage, many of which are offered at VET providers. Postgraduate and research degrees in this area provide students with expert skills and knowledge to specialise in an area or field of choice. Examples of postgraduate programs offered by Australian universities in health include Master of Health Services Management, Master of Mental Health Nursing, and Master of Public Health, to name a few. Leaving an Australian university with a qualification in these fields means that students will have the skills and knowledge to address the world's most challenging healthcare issues, which is very important at the moment. Healthcare workers are in demand in Australia and around the world. Programs in Australia are designed to make students job ready and prepared for one of the fastest growing industries. There are so many possibilities in the health sector in Australia, especially if you're wanting to make a difference and help people become healthier. I hope you found this information helpful if you're considering studying a health degree. This information we've compiled and presented by Studying in Australia TV is not legal advice, so we'd recommend that you seek further information from the professional bodies directly, or alternatively, our team can provide general assistance. Let us know if you need any help with your study choice or professional membership. We're always happy to help. Stay tuned for more professional body information for other study discipline areas that can lead to excellent work experience in Australia. Goodbye for now.